everybody, Dr. Rob Silverman here. I'm in with my great friend, CEO of KBMO Diagnostics. Nobody's going to enlighten you more on blood labs and the behind-the-scenes look at blood labs than my good friend, Mr. James White. James, thanks for coming on.
Hi, Dr. Rob. Pleasure as ever. So always fun to kind of come on and discuss about testing and not guessing.
Without question, as we segue right into, why would someone want to test and not guess?
It's a great question, isn't it? It's like, I think it's all down to now. I think we're all looking at how do we personalize our medicine versus the one size fits all model that I think we've all known has been broken for a while. And I think post COVID, I think we've got a lot of clients who are going, I better look after myself because if I don't, no one else is going to do it for me. So I think there's definitely been a rise in patients, stroke consumers looking at how do they take care of themselves. And I think certainly testing is a great way or kind of starting point on any journey to kind of work out where they want to go, because like everything in life, if you can at least find out where your base point is, you can then hopefully move your trajectory up or down depending on what you're looking for from there.
You know, when we talk about testing and not guessing, let's be specific. We're talking about blood serum tests and blood spots. We find they are the gold standard. So would you like to expand upon that just a little bit for the followers and the listeners?
Yeah, so it's one of those things we've developed. We started off with a blood draw test, and we were very fortunate. We had a brilliant man called Dr. Brent Dorval who invented our test. And again, he developed our fingerstick version of the test, which meant that it correlates exactly the same as our blood draw. And so what we found is, obviously, to make it easier for the consumer, if you can do a fingerstick test in the comfort of your home, then that's much easier than trying to find a draw center. So again, what we found is for not only the patients but also the providers, not every provider has access to a blood draw station. So we found it would be much more convenient, and I think that's basically what we've done with all our labs. Is how do we make it convenient for the patient and the doctor? And I think that's a key element that we're looking for, is trying to make it convenient for both sets of parties. Obviously, the patient who has to do it, but also the busy provider that doesn't necessarily want to add a member of staff of a phlebotomist. So that's one of the big issues. The other neat thing that we've seen over the years is that people have warmed to this concept of testing from home versus going in to see their doc to get all their testing done. And so that's been a transformational change post-COVID, I think, or during COVID, that you can't always go and see your doctor. And so the other nice thing, just to show from a validation standpoint how accurate it is, the NIH put a study out a couple of years ago showing how well the blood antibody testing correlates with fingerstick testing. So again, you could argue that James is going to tell you that it works really well. But the reality is, what we love to do is point our providers and patients who are kind of skeptical of, is that the case, to the NIH. And again, they're obviously a world-renowned organization. And so again, we're always happy to have to use an external source to validate what we're saying.
So to recap, basically the idea of blood serum and finger spots is the gold standard. It's the ELISA test, without question. Not to say other testing isn't effective, but this is the standard bearer. Number two, you really spoke about the convenience. As a practitioner, this has really changed my credo in the ability to test, because now it's expanded me beyond state lines. It's expanded me, believe it or not, beyond the continent in which we live in, because you're in multiple continents. So it's giving the patient the opportunity in the confines of their home to be able to test and have the doctor get the results. Plus the fact where we are in New York, there's certain types of practitioners that have doctoral rights but can't draw or are not comfortable with drawing blood. The finger spot, it just cures all within that. So it's been, again, a breakthrough for me to utilize. And I think a lot of people are asking, number one, like, what is your number one go-to test? What would you recommend first for the doctors and the consumers alike to utilize?
Yeah, so we have a number of different panels, but the key one that we've seen the most uptake from providers and patients is our FIT 176, and that basically stands for the food inflammation test. And the 176 talks about the number of foods, colorings, and additives, which I'm sure we'll get onto in terms of talking about the importance of those as we go through this. So it's 176 different foods, colorings, and additives, And as well with that, we've added a gut barrier panel, which we'll go into as well. So the idea was to try and, again, working off that, let's test, not guess, look at a number of these subsystems that are present in all of us, not only just looking at the foods and inflammation, but let's also look at immune health as well by bringing in the gut barrier panel. So that was the key here, is how do we look at immune health? And I'm sure any of you have got had the pleasure of listening to Dr. Rob. He'll tell you that all disease starts in the gut. So the idea is, how do we make sure not only are we looking at inflammation, which is the root cause of pretty much all disease states, but let's look at the gut as well, given that's where everything starts from. So the idea is, when you start putting those two together, it gives you, the patient, and the provider that you work with, a great stepping off point to go, okay, how do we work with this patient, given that we now have got a really good indication on an individualized basis of what we should test them for, but more importantly, what's going on from an immune health standpoint through the gut barrier panel as well.
Well, there's a lot to unpack there. Really great conversation, please. So we're going to table the idea of food sensitivities for a moment, but we've definitely got to cover it, because for me, food sensitivities are one of the leading causes for chronic hidden inflammation. And my credo is to manage and modulate inflammation. And in the idea of inflammation, you refer to the idea of immune system. So when your immune system is dysfunctional, inflammation is increased. There's two portions of the immune system that everybody talks about. They call it the innate and the adaptive. The innate immune system is what we have when we were born. It's our immune system. It is our 24/7, 365 security guards of our immunity, macrophages, neutrophils, and all those fancy words and the like. They are very stealthy, and they're the sentinels of our immune system. They communicate with our adaptive immune system, hence the idea adaptive is something that we get along life. It's our body's experiences, and they produce B and T cells. T cells come from the thymus, B cells come from the antibodies. Antibodies, we go into more of detail if you'd like a little later on antibodies, but the idea, the balance of this immune system is critical for overall health and our overall inflammation. Now, the third part of our immune system, which is really the first part of our immune system, is our digestive system and our gut barrier. Our gut allows the outside world to actually meet the inside world when something gets absorbed through the small intestine. So your gut barrier panel is based on what's going on in the permeability or increased permeability of the gut, and or what's going on inside the gut, very special, in reference to its ecosystem. And lastly, it's looking for inflammatory markers and antibodies, which really differentiate yourself, because my understanding of your test is the only test on the market that uses the technology of the two different immune systems, and the third immune system is added with the gut barrier panel.
Exactly. And so the great thing is, we are the only patented food sensitivity test on the market. And so that was a key point in terms of the science behind the test. I also already mentioned Dr. Brent Dorff, but again, his not insignificant claim to fame was he invented the first rapid HIV diagnostic. So we've got that, everything we do is percolated through that infectious disease lens, as it were. Great example of that is, we'll run 15 standards of controls to make sure your test is highly accurate and reproducible. And so we want to make sure that the testing we carry out, you can have great confidence on, in terms of the foods that you're asked to eliminate by the provider that you work with. So again, really important for us to make sure that we're giving you the best science available. And that was really what got us into the gut barrier panel. And the markers that we chose was trying to work out, how could we give the best possible testing out there. And again, we developed the food sensitivity test from scratch, and we've done the same with this, in terms of working with some of the greatest key opinion leaders in the world to come up with the key markers that give you a really good way of understanding, how good is your immune health, alongside which foods are causing you an inflammatory response. As Dr. Rob said, it's that multiple pathways which we had patented, which gives you a really good way of eliminating, in science talk, false positives. But a great example of that, for example, if you just look at the IgG, you come up with 20 or 30 foods. And I think what I hear from a lot of providers, they say it's a disaster because it puts my patient in a food prison. And so what they want to do is have a test that doesn't look at all these false positives, but eliminates those and zeroes in on a handful of foods which are actually the root cause of your problem, i.e. causing an inflammation, and that's the innate immune system that Dr. Rob was alluding to. So the cool thing here is we're looking at those two pathways, helps eliminate the false positives, and really zeroes in on the key foods of interest. And that's where I would argue is where the magic happens for our test, because for a patient, they can be compliant with a handful of foods. They're not feeling really depressed because they've got all these foods that they have to eliminate. It's really zeroing in as an individual which foods are causing that inflammation issue versus anything that you were just exposed to.
It's so funny. So many patients and doctors ask, why would I test for food sensitivities? It's just food allergies. Now, food allergies, they're IgE mediated. You'll know them because you'll swell, you'll get red. I was just on a flight and, it was a typical thing that we heard, understandably, but typical in that someone has a very high allergy to peanuts. Please don't open any peanuts. There'll be no peanuts because somebody could literally die. Food sensitivities are vastly different. There is a 3-day lag from the time of ingestion to the time that symptomology comes out. So that's obviously 72 hours. So as a patient, how would you know that if you had broccoli 3 days ago and today your inflammatory symptomology is elevated or your condition is now activated, you wouldn't know? As a practitioner, how would I know what you ate stimulated that inflammation? So this really exemplifies, in my opinion, the need for testing and not guessing, coupled with the idea that when you're talking about inflammation, COVID taught us a lot of things. It taught us one thing: most Americans are pre-inflamed. And I think a great contributor to that is the fact that most Americans have some form of food sensitivities. It's about 70% of Americans that have a digestion food sensitivity problem.
Yeah, I think you hit it on the head there, Rob. It's the key here is you're testing these different elements. You get to the root cause of it. And again, everyone is now looking to take care of their health in a number of different ways. So I think here we can get you to the root cause of that. And those symptoms are many and varied. And as you rightly point out, who can remember where they were 72 hours ago, let alone what they've consumed in that time scale? So again, that's why in our minds, it really lends itself to be testing, because again, you're guessing otherwise. And it's 3 days of your diet, and we're all we're creatures of habit to some degree, but we're eating so many different elements. So the neat thing with this test, it gives you a really quick way of getting there. The best explanation I've had about these multiple pathways is from one of our providers in a place called Chagrin Falls, Ohio. She said, James, what I love about this test is with the test that I tell my clients is we're looking at the whole immune system versus half of it. And that's a really good way of trying to explain that to kind of listeners, to say, look, you want to look at everything that's going on from an immune health standpoint, not just half of it. And I think that's a really compelling argument why you want to look at something like a KBMO test. It's patented, but you're looking at that whole immune system to make sure you can get yourself a really good understanding of what might be causing you an inflammatory response based on your diet, which is something we all have to do. We all have to eat. So on that basis, it really covers the gamut. There's not a patient out there who I'd contend would not benefit from running a food sensitivity test based on, as you say, Dr. Rob looking at modulating your inflammation and equally trying to make sure it's a personalized care for you, the individual, versus the horrific one-size-fits-all.
Piggyback on what you said, that is why 80% of our immune cells are in our gut, because our largest amount of possible carnage can come from what we consume. Good food is a potentiator for health information. Bad food is a potentiator for inflammation. So we need to choose wisely, and we need to understand. Segueing right into the gut barrier panel, food sensitivities could be one of the reasons for, if you will, a leaky gut or an unsettling of the ecosystem. Let's start getting into the dynamics and breakdown of the sections of the gut barrier panel.
Yeah, so when we came up with it, we thought, let's look at a number of different elements. So we measured a thing called Candida, which again is present in all of us. But what we wanted to do was work out, could we get to the level that shows that might be some early indication of what your provider will talk about is dysbiosis. So an early indicator of some kind of activity. Again, what we would describe as kind of canary in the coal mine, as it were. What's going on? Some early indication that the provider might need to consider, what from a symptomology standpoint is causing this. So again, we measure the Candida. Then we look at, as Dr. Rob was talking about, those tight junctions. And we don't, which is the kind of that gateway into from the outside world kind of looking in type thing. So the idea here was to look at both the function and the structure of those. So again, I'll get Dr. Rob to do his hand movements here because he does a great example of how those tight junctions work. But again, the idea is, if you can think about it, why don't we look at the function and structure? Now, the two markers happen to be called Zonulin and Occludin. We'll try not to repeat that again because that's confusing for patients. But the way to consider this is we're looking at your structure and function again. So function, the first level, i.e., is it performing well? Structure, like any house, is it still standing up, or does it begin to crumble and fall apart? So the idea is that's why we wanted to look at those two elements. And the kind of fourth element we added to here was a thing called LPS, which stands for Lipopolysaccharides, which again is more in the gut and looking at the gram-negative bacteria. But again, back to those different types of immune system, a strong stimulator of that innate immune system as well. So again, trying to kind of tie all these things together to say, look, let's look at inflammation, let's look at the whole immune system. And as we add markers to look at that gut barrier, to make sure all these things begin to hang together from a making sense standpoint. So as you can imagine, if you just ran a test that was looking at IgG only, you miss half of the immune system. And when you look at the gut barrier panel, that's not even included. So you're missing things like the LPS. And then, like we talked about, the structure and function of those tight junctions as well.
Right. So I'm going to, again, piggyback a little bit on what you said, talk about Candida. As you said correctly, without question, everybody has yeast. The problem is when yeast overgrows, it becomes an issue, and it can cause this unsettling of good and bad bacteria, which is called dysbiosis. We need 85% good bacteria to have health. So we really don't have a lot of leeway to cheat on our diet or have a lot of leeway to have a yeast overgrowth. The yeast communicates directly with our immune system. So a yeast overgrowth, which I like to refer to as a small intestinal fungal overgrowth, I think the data will really start to bear that out as a term or an acronym, if you will. So yeast is an issue, and there's a separate way to treat that. In addition, you did a great job about the zonulin and occludin. So zonulin, best bet. Here's one epithelial cell. Here's another epithelial cell. They come together. It's called a tight junction. Can't see me. I'm playing hide and seek because the junction is tight. Zonulin, which is a functional pull on the junction, comes apart. I can now see, and what that means is things on the inside of your gut can seep through to your bloodstream. That's a problem because obviously it's a screen door of your gut. The occludin is the structural fibers, and that rips apart. So now your tight junction has become a loose junction, a broken junction, and is going to be more involved. And lastly, as James said, lipopolysaccharide. My nickname from where I come on the Northeast is we call it El Diablo. It holds the gram-negative bacteria on the inside of the intestinal wall while it hangs out on the outside of the intestinal wall. When LPS is elevated in the bloodstream, it is an inflammatory vex. It just elevates inflammation. So much so it can combine with different structures and damage them, like your ovaries, your testes, just to start, your brain, your lungs, and your heart. The expression of LPS increases the incidence of heart disease by 3 times, which really segues us to the next test to have the completion to the puzzle. I always say it's step 1, food sensitivities, step 2, the centerpiece, the gut barrier panel, and step 3, the cardiovascular inflammatory test, because step 1, step 2, step 3, let's talk about cardiovascular testing.
Yes. So again, like the two tests that we just described, the food sensitivity and the leaky gut panel, they're both fingerstick tests. And so what we wanted to do was try and come up with a way of making it, again, easy for the practitioner and the consumer to do this test. We've done significant validation work, and we have that available on our website as well. But the key was, how do we make it easy for patients to be able to run this test in the comfort of their home or with their provider? And so that's what we did with this test. So again, it's collecting at home. The testing is being done in the lab. So we just want to make sure that's clear as well. But again, the collection takes place and then that comes into us. And the idea was, how could we improve on the standard of care, which is a thing called the lipid panel, which unfortunately has a number of measured markers, not actual direct markers. And they're really slightly worrying, to say the least. 50% of patients on the day of their heart attack have a normal standard lipid profile. So again, I would argue that if that's standard of care, then none of us want to have that standard of care, because that's pretty appalling. But it's generally because patients aren't getting tested earlier, back to the testing, not guessing. And so by the time they get around to actually getting these tests done, it's way too late. So the damage has been done over decades. So the idea is that's why it's so important to get tested regularly, to make sure you can be ahead of the curve, to kind of make sure you don't end up with a heart attack or some of the other diabetes or some of these other kind of diseases, kind of lifestyle related, that you can really aggressively do something about. And so that was the starting point. How do we improve on that? And looked at a couple of really, I think, in our minds, obvious markers. So there's a thing called ApoB, which is the #1 indicator of cholesterol worldwide. So again, it's a marker that's well found outside the US. Again, not wanting to cast aspersions on our good friends in the insurance industry, but unfortunately, ApoB, there's only 5% of the US population has been measured for it. So it's one of those ones that, again, if you have the fortune of seeing a Dr. Rob or any one of our providers, they will test you for that ApoB, and again, give you a really good indicator of what might be going on from a cholesterol level, which is obviously mission critical when you think about this. The other marker we added is a genetic marker. And again, I don't want to be down on genetic markers, but often they're 1 or 2% of the population, which I would argue is, you're probably better off buying a lottery ticket rather than running those tests. So this one with an Lp(a) basically indicates how aggressive you will be at creating plaque in your system. Plaque obviously means that the blood flow in your arteries will slow down, so it's not a great thing. However, 30% of the US population, so that's 1 in 3. So again, if there's 3 of us on this call, there's a likelihood that one of us would have it, has got this genetic marker, which is a predisposition to meaning that you aggressively grow more plaque in your system. So again, the good news is there's supplementation and pharmacologicals coming down the line which can treat that. Now, again, if you thought the ApoB was pretty miserable at 5%, Lp(a), my friends, is at 1%. So again, go in and see a Dr. Rob or any of our good providers around the country or internationally, as we have them, who can run that test and give you an ability to kind of get ahead of the curve on making sure you're not one of those statistics that we talked about earlier. So the great thing is, the idea was to bring in some really quality markers that will have a significant difference in how you go about your daily lives, not going, oh my God, so 1% option of maybe this might happen to me, this may not. These ones are dramatic differences, which you all want to know about and should know about. And that's why it's so important to get tested for our CIT panel, so the cardiovascular inflammation test.
Without question, I'm robust on the idea of utilizing ApoB. As you said, 5% of the population, it's all the bad cholesterols in one big boat. And it's a much more accurate figure. ApoB and ApoA versus just as total cholesterol, standard cholesterol markers, 3 times as a predictive of a heart disease. Lp(a), as you said, the genetic hereditary marker, 1% of the population. It's the glue, the reason for plaquing. But not only are you taking it for yourself, you're also taking it for family members. 40% of your family members, if you have the ApoA, will also have the ApoA. Now, people always ask, why were you not testing for this? Well, I am not a conspiracy theorist, so I'll put my neck out on this one just for you, James. I'm going to spare you the sword. Lp(a), there's no drug yet on the market that's known to decrease Lp(a). In fact, unfortunately, please be warned that statins in the incidence of Lp(a) raise it. They also cause calcific plaquing to 52% on the outer membrane. Within that, nutritional supplementation, lifestyles have showed strong decreases, precipitous decreases in Lp(a) numbers in empirical research. So obviously, any kind of condition you have, lifestyle is a great add, and more so than that, this is a great test. So you want to start with the food sensitivity test, you want to get into the gut barrier panel, and then you want to segue into cardiovascular inflammatory testing. Interestingly enough, there are some studies that have shown a dramatic increase in cardiovascular incidence from food sensitivity. So we're starting here and going through the whole gamut. I do think that we should talk about how to interpret the test a little bit. I think we may have glossed over with the IgA 1 and 2, IgG 1 through 4. We really want you to hit home on that and talk about C3d.
Perfect. So when you look at the gut barrier panel, what you'll see is an IgA column, and then a IgG 1 through 4, plus the C3d, the complement activation as well. So how we get our providers to interpret that is to look at the IgA 1 and 2. IgA is a well-known secretory marker, which generally indicates that what's going on is still in the gut. So it's not systemic all around the body. So it's generally in the gut and still early stage. We measure IgA 1 and 2, and Dr. Rob can explain about the IgA 1 and 2. So the idea is, if it's a red marker in the IgA 1 and 2, along the lines of the Candida, the Zonulin, the Occludin, or the LPS, still early stage, indicative of it's still localized in the gut. Whereas when it transfers over into the IgG 1 through 4 and the complement, it generally means IgG is indicative of longer term, and the symptomology is generally more systemic, i.e. it's been going around for a longer time period. So the idea with this panel is we didn't put numbers on it, not that we don't understand any numbers, but more we wanted to make this intuitive for patients and providers to understand it, i.e. if it's red, generally means indicative of something's going bad. If it's green, the levels are okay. And in fact, when you get your report back, what you'll see is what we write in the bottom. If any of the 8 markers are elevated, then you should refer back to your provider with regards to a good gut healing protocol. So that leads us, I think, into Dr. Rob's piece of saying, well, okay, so if you get the results back on something like this, how do you treat the patient? So Rob, how do you go through that with a patient when they've got elevated markers in their gut barrier panel?
Well, like you said, what's great about it, and I like, just like your emblem in the back, red and green. Red means stop, green means go. It's good. So IgA 1 through 2 is, as you said, a secretory marker. It can be elevated from damage at the mucosal membrane at the nose, the lung, but most predominantly at the gut. So now you have an early onset injury. So again, we're going to remove foods. You're going to adhere to something like a 7R program. You're going to remove the foods that are stimulating inflammation. You're also going to remove, as you look at the full test, if there's any bacteria or Candida or things of that nature. And then you're going to try and regenerate the area. You're going to decrease inflammation in the gut and try and heal and seal the gut lining if warranted. An interesting clinical gem is everybody runs for probiotics, and probiotics have their place. Not that I'm trying to go off on a tangent, but it's almost ineffective at this juncture to take a probiotic without coupling it with a prebiotic. Probiotic gives life, it's bacteria. Prebiotic feeds the probiotic. Segueing back, really want to emphasize that you test for IgG, but IgG 1 through 4. Many companies only test for IgG 1 through 2. IgG 3 and 4 are critical, especially 3, because IgG 3 allows you to stimulate your innate inflammatory system. And you do so by testing with the most stable inflammatory molecule called C3d. And that's where you really hit the secret sauce because of the dual purpose technology. So to put it in a nutshell, if I see IgA elevated, it's at the gut level, it's an early onset. If I see IgG 1 through 4 and C3d, you have inflammation floating in the bloodstream for a while. Obviously, you're going to need to address either or both of those.
Perfect. Hit it on the head. Ideal. I mean, I think, that's the nice thing is for patients and providers, we're trying to make this an easy conversation to have. So the concept of how we've generated these reports is to make them easy to read for the busy provider and the patient. Because again, we don't expect a patient to be a PhD brilliant scientist like Dr. Brent Dorval, who invented the test. We want to be able to articulate these results so the busy provider and busy patient can look at them and go, red, that's a problem. Or stop and go, as Dr. Rob quite just gave the example of. So in our minds, what we want to do is simplify the complex to make sure that we can improve patient compliance. I think that's a key element, but with really robust science. And so that's the difference, I think, us with a number of other labs is start with robust science and then make sure it's an easy message to articulate to your patient so that they can be compliant. And then that's where I think we see the wonderful patient outcomes that we hear from our providers who are out there in the field.
Yeah, the color coordination works for me. You know, if it's easy for the doc, it's easy for the doctor to elucidate to the patient. The patient understands, there's more compliance. That's really where the magic starts. I want to do a couple of lists, though. I think it'd be great. So give me a list of 5 or 10 of the most common foods that people are sensitive to.
Yeah, I mean, the obvious ones are the big three of egg, milk, and wheat. And again, we have a lot of providers who say, James, we're going to look at an elimination diet. I'm going, well, that's an approach. Pretty time consuming and laborious for the patient. So I'd argue if you get told that, then they're making you do their job a bit, but that's okay. The other issue with an elimination diet is with the test, we're measuring colorings and additives. And those colorings and additives, I would argue, show up in kind of how I would describe as a 3D world. So you'll see them in processed food. And again, we're all guilty of eating processed food. And so secondly, you'll see them increasingly in some of the supplementation that people are recommending. And thirdly, where you see them is personal hygiene products. So things like shampoos, washing powders, things like that. So we've had examples where we've had patients who've been elevated for one of those colorings and additives that we measure is benzoic acid. And so again, there was I can think of a 10-year-old boy, very lethargic, which is, if any of you have got a 10-year-old boy, you know that's not the usual state of activity. So found out that it was in his mum's washing powder and the shampoo they were using on him, high levels of benzoic acid. They eliminated that from his diet. Within 6 to 8 weeks, he was back to his normal self. And that's why I believe it's so important to do a test versus a one-size-fits-all type elimination diet, because there's no elimination diet in the world that says, why don't we think of looking at benzoic acid? Just not even on the radar. So the idea is that's the benefit of running this test. You're looking at many foods and as well as those colorings and additives. As I say, it doesn't matter how clean, how organic you are, it's impossible to get away from them right now. So the idea is that's why it's so important for us to measure them, because it gives you a different insight into the world, and it's a real life world versus something that doesn't, it's I think almost naive to assume that you're not being exposed to the environmental toxins.
I mean, that's a real look behind the curtain when you talk about emulsifiers and additives. And that leads to maybe another conversation, which we'll pick up at another date, hopefully have you back, about testing for the gut because of the gut to liver complex. There's a great example of 75% of the toxins that pass through the gut because the gut could be leaky, get to the liver via the bloodstream, and 25% go to the portal vein. So now we're talking about some complexity of the gut to liver, gut to brain. If the three of them are working together, I call it a trifecta of health. If not, the Bermuda Triangle. But we're not going to go down that rabbit hole. I want to do some lists. So give me a list of conditions that you would recommend or you've seen most common that the doctors want to order the test for to reveal what's going on from either the FIT test and or the gut barrier panel.
So it's really interesting. When we started off, everyone used to think, well, it's got to be gut related because it's, gut, stomach, that's what I should be testing for. Those are the symptoms and types of patients that, I should run this test on. Then increasingly what we saw was skin related, because again, the reaction to your skin is in terms of psoriasis, any of these types of things, is an inflammatory response. And then we did a study about 12 years ago now. And what was really compelling to me was that we saw anxiety, depression, migraines. So opened up this whole new environment of not only leaky gut, but leaky brain. And so as over the time, we've had a number of really brilliant neurologists running the test because they recognize the world in a slightly different way. So rather than going leaky gut, leaky brain, they say, James, you got it wrong. It's leaky brain leading to leaky gut. And again, back to the similarities between all these tests, you're looking at the tight junctions, and those tight junctions don't just stay in the gut. They're in the brain, they're in the liver. Back to what Dr. Rob was talking about. So the neat thing now is we see that all of the underlying symptomology is inflammation, but that inflammation shows up in brain-related issues, gut-related, skin, migraines, and then increasingly in autoimmune patients as well, where, again, the underlying cause of most autoimmune disease is inflammation. So if we can help that patient reduce that inflammation, then generally what they see is maybe not a total cessation, but general reduction in that inflammation. That definitely is, we see some great impact in terms of the lessening of the symptoms that they may well be presenting with as well. So I would say, Rob, those are the big ones. It's the brain-related issues, migraines, depression. Migraines, we've had some phenomenal reactions there where, again, patients have suffered multiple years, decades even, of migraines. And I've been told by providers where they've eliminated, and it was generally only 1 or 2 foods. It wasn't, a complex 12-month study. It was within weeks they noticed that they were seeing a great reduction in the number of migraines that we're seeing. It's really interesting. We had all these things around brain, around gut, autoimmune type symptoms, skin related. And so we did a study recently with one of our partner labs in China, and they took all those different areas. They took all comers. There's 74 patients in all. And they went on an elimination diet for 3 months based off the test results. So again, fan of an elimination diet once you've got some data to back it up. So for those patients, they had a 3-month elimination diet. And then at the end of that, they saw an 82% improvement in the symptoms they presented with. So again, the reason I kind of highlight that is it works on so many different levels. But again, not a surprise for anyone listening to Dr. Rob talking about root causes. Again, if you can get to that root cause of the inflammation, those symptoms are many and varied, but that root cause remains very constant. So the idea was, let's run it in a lab in China. So again, we didn't choose any of the patients. All we did was provide them the ELISA test, as Dr. Rob said, the gold standard. They ran the test, they chose the samples, or the patients rather, and they sent us back the data. So again, just to show how robust our technology is, even in a lab in China where clearly we have no control over, we saw these amazing outcomes. So it's really gratifying for us that because we control that whole value chain, i.e. we make the test, we source all the organic foods, so we know where everything's come from. That attention to detail leads to those amazing clinical outcomes that they even demonstrated in the lab in China.
You brought up a plethora of good points, but just remember, everybody, gut on fire means brain on fire, or brain on fire means gut on fire. Bidirectional. It is without question the super highway to health, not health, super highway to health. And let's not forget that whatever you do to your gut speaks to your brain in a millisecond. And that's no surprise when you see the mental health. I suffer from anxiety. I don't like to fly, even though I fly everywhere, but it's a whole ensemble for me to go. I can't drink coffee. I can't drink sugar. Otherwise, I'm a lunatic. But it was unbelievable to see that gas and bloating is so commonly associated with gut to brain axis, and it is, but the anxiety and depression was even more so in symptomology. Some other key points that, or at least takeaways to me, were, believe it or not, homocysteine, which is a stroke marker, which is usually elevated from your inability to appropriately methylate the MTHFR gene, was precipitously decreased from taking away food sensitivities, which really speaks volumes to the idea of what that homocysteine is a true inflammatory marker. IBS decreased dramatically, no surprise there. C-reactive protein, I mean, these are serum objective markers. It's great to get a subjective marker.
And I'll throw another one in there. So there's studies out there showing zonulin, which we've been talking about with those tight junctions, that declined precipitously as well for patients who had high risk of cardiovascular disease. So again, it's really fascinating to see, guess what, those tight junctions are all interrelated, all these markers are as well. And so I think that's the wonderful thing. Again, we talked about El Diablo, your friend El Diablo, to LPS. Massive links now and studies being done linking to cardiovascular disease. So again, all these systems, what a shock, are systems, and they're all interrelated. And so that's why I think the importance of measuring those 3 tests that we've come up with, because it gives you such insights now into what might be going on in the patient's health by looking at them, given that we're now, again, recognizing that to probably visit a physician who's just looking at your cardiovascular health or just looking at your gastroenterology health doesn't make a lot of sense. You should be going to a good functional provider like Dr. Rob, who brings all these pieces of the jigsaw together through testing, not guessing.
And just to really surmise what you said just before about the gut and LPS and going to cardiovascular, leaky gut, leaky blood vessels now. I mean, so basically testing like you're doing is turning the world upside down. I mean, the traditional docs are scared because they've been locked in a very myopic view. Whereas now we want to see the full terrain and the full field. You know, if you as a doctor or a quarterback, we'll call Tom Brady, I'm aware that he's retired. His great ability was to see the whole field and put it together in a quick time period. Same thing with the doc, and I really concur with James. You're looking for somebody who does believe in root cause resolution. Testing in specific tests can allow you to see clearly where the root cause is, because symptoms, there are thousands of symptoms. But when you look at symptoms and you grill it down into systems, there's only 14 systems maximally in the body, then you have a better chance of getting it down to root cause resolution. Because remember, all the systems are interconnected as the body is interconnected. And that's what makes pieces to the puzzle so needed. Testing is a huge piece to the health puzzle. I don't know if we can end on any better note. Well, it's been my pleasure. I think
you nailed it. I mean, that's exactly it. I mean, I think, you know,
waterboard time.
On that. Exactly. If I had a mic, I'd drop it, but I don't. So there we go. I think that.
There we go. We had a good time on the podcast. Exciting. It's been great. I mean, it's always exciting to talk to you. You have over 20 years experience in the blood testing world. You use a myriad of different types of practitioners. So you get it, you know, anywhere from naturopaths, chiropractors, personal trainers, all the way to the Harvard PhDs, medical doctors, neurosurgeons, etc. So you really did a great job of synthesizing everything for us. I'm excited. If anybody wants to get in touch with you, let them know how they can do it.
So obviously just come to our website, KBMOdiagnostics.com. And again, for those of you who are struggling to remember KBMO, K stands for Catherine, my wife, B for Ben, my son, M for Max, my other son. And as we say, we saved our best to last. Olivia is the O in the KBMO. So it's KBMO Diagnostics.com. And so if you come to our website, we'll make sure that if you don't have a provider, we can link you up with a provider. And again, we think, as Dr. Rob does, that this is an important test, but in the myriad of your overall health journey, then we want to make sure you've got a good person to kind of work with you on that journey. And so that's why we love working with the likes of Dr. Rob and a number of the other great providers out there across all these different areas who have worked out you need to bring all this information in together. And again, that's the importance of these diagnostic tests, to give you as an individual that confidence in making sure that you're on the right path to whatever health journey that you may have as an individual.
Well, I knew you were a smart man, but you definitely confirmed it when you put the first initial in your business as a reference to your wife. Kudos to everybody. My wife is clapping. My whole staff is cheering for you. Thanks for unsettling the apple cart in my house. I appreciate that. It's been my pleasure. Mr. James White, CEO of KBMO, Dr. Rob Silverman, Proven Health Alternatives. See you soon.